Hello. This presentation will be an overview of Castle Biosciences genomic testing services for patients with uveal melanoma. Castle Biosciences is a commercial stage diagnostics company focused on providing clinicians and their patients with personalized, clinically actionable genomic information to help them make more accurate treatment decisions. The company currently offers tests for patients with cutaneous melanoma, suspicious pigmented lesions, cutaneous squamous cell carcinoma, and uveal melanoma. We also have active research and development programs in several underserved and dermatologic diseases with high clinical need. Our uveal melanoma test, DecisionDx-UM, was actually Castle's first successful commercial offering. This test was developed by Dr. William Harbour and was in-licensed and launched in 2009, and it will be the focus of this presentation. Castle currently offers 3 tests for patients diagnosed with uveal melanoma that can all be run from a single biopsy of the primary tumor. 2 of them, DecisionDx-UM and DecisionDx-PRAME, are RNA-based tests that use standard RT-PCR to measure gene expression levels, and DecisionDx-UM-Seq is a DNA-based test that analyzes mutations across the 7 genes that are commonly mutated in uveal melanomas. Turnaround time for the RNA-based tests is about 10 days, and for sequencing, it's about 15 days. It's important to remember that of the 3 tests that Castle offers for uveal melanoma patients, DecisionDx-UM is the only one that has been prospectively validated and confirmed across multiple studies. The other 2 are optional adjunctive tests whose prognostic value is still under investigation. So a little bit more about DecisionDx-UM. How does this test work? DecisionDx-UM measures the expression levels of 15 unique genes in the patient's primary tumor to determine whether the tumor is at low, intermediate, or high risk for metastasizing within 5 years. And timing is really important. This test must be performed before the tumor tissue is exposed to radiation. The first clinical validation of DecisionDx-UM came out of the Collaborative Ocular Oncology Group, or the COOG. This was a study that included 459 patients from 12 centers who were prospectively tested with DecisionDx-UM. As you can see from the pie chart, about 60% of tumors came back as Castle Class 1, so low risk, whereas about 40% of tumors came back as Castle Class 2, or high risk. And the survival curve on the right is striking because it clearly demonstrates that the test was accurate at predicting metastatic risk between those 2 groups. After 5 years of follow-up, 97% of the Class 1 patients remained metastasis-free, compared to only 20% of the Class 2 patients. And in multivariate analysis, the DecisionDx-UM class result was superior for predicting metastasis when compared to clinical factors, pathology, and chromosome 3 status. This study did look at a subset of patients who had had both gene expression profile testing and chromosome testing to compare the results from each of these different prognostic methods. And so among patients who had had both types of testing performed, 20% of cases were discordant. So they were either low risk by Castle class, but high risk by chromosome testing, or they were high risk by Castle class and low risk by chromosome testing. And in these 20% of discordant cases, the gene expression profiling result, or the class result, was actually found to be more accurate than chromosome 3 status in terms of predicting patient outcomes. And you can see that those discordant cases plotted in the survival curve in blue and in red. Now, since the initial COOG study, many independent studies have been published that are listed here that support use of the gene expression profiling test. Altogether, published studies on DecisionDx-UM have included more than 2,800 uveal melanoma patients, so a very robust body of evidence supporting clinical use of this test. Now, this table just highlights those studies that have reported 3- and 5-year outcomes. So following the initial prospective validation by the COOG group, which is shown at the top in gray, multiple subsequent studies have found very similar results. And so you can see the consistent rates of 3 and 5 year metastasis-free survival for the class 1 patients in blue and for the class 2 patients in red. Because of the high level of evidence supporting use of the DecisionDx-UM test, it has been included in the NCCN guidelines for uveal melanoma since they were first released, and it's now utilized in about 75% of newly diagnosed uveal melanoma patients across the US. As shown here, the guidelines recommend different imaging intervals for UM patients based on their class result, with the highest risk, class 2 patients, recommended more frequent imaging than the medium and low risk patients. And this schematic just summarizes how physicians are incorporating this test into their practice to guide decisions about metastatic surveillance in clinical trials. And the main point here is that with DecisionDx-UM, the high-intensity surveillance and adjuvant treatments can be focused on the class 2 patients who really need this type of management the most to promote early detection and treatment of metastatic disease. And conversely, the class 1 patients who really account for most of the tested population can be removed from such aggressive surveillance plans since they are highly unlikely to experience a metastatic event. Finally, we know that patients play an extremely important role in the planning of their care. And a recent survey of 177 uveal melanoma patients that was recently done in collaboration with the Melanoma Research Foundation found that 90% of patients reported wanting prognostic information at the time of their diagnosis. Of those who had testing specifically with DecisionDx-UM, 99% of respondents reported gaining value from their test result, including increased knowledge and understanding, information relevant to life planning, more personalized care, and relief from uncertainty about the future. Thank you so much for listening. We look forward to serving you and your patients in the future. And if you have any questions at all about our uveal melanoma testing services, please feel free to contact me directly at the email address provided here.